Good evening and hello, everyone. My name is Desiree White Foster, and I have the pleasure of today sharing my reflection on my interview with registered nurse Destiny White Foster, RN, who happens to be my daughter, who currently works at the Pediatric Emergency Department and previously worked on a medical surgical unit. How I felt about the interview. Overall, I feel very proud and deeply reflective during the interview. Professionally, it was very inspiring to hear how Destiny has grown in her communication skills as a registered nurse, particularly in high acuity and emotionally charged situations. Personally, the interview was meaningful because it connected directly to a family experience involving acute delirium of a loved one, which was frightening and emotionally challenging for both of us as her grandmother and my mother. The interview reinforced how critical effective communication is, not only for patient safety, but also for supporting families during vulnerable moments. Communication skills and techniques observed. During the interview, several communication techniques were evident. Verbally, Destiny emphasized the importance of clear, concise, and developmentally appropriate language when communicating with both pediatric patients and their families. She explained how sharing the plan of care is understandable in understandable terms helps reduce anxiety and builds trust. Non-verbally, she described being attentive to body language, tone, and emotional cues, particularly recognizing parental stress and fear when caring for sick children. This awareness allows her to adjust her approach, offer reassurance, and provide comfort even when words alone may not be sufficient. Two ways the interviewee uses professional communication. One way Destiny used professional communication is in her practice is through interdisciplinary collaboration. She described advocating for protocol development related to acute delirium by communicating concerns to leadership, collaborating with fellow nurses, and engaging physicians in discussions about medication related causes of delirium. A second way she demonstrates professional communication is through structured tools such as the SBAR. She explained how SBAR supports timely decision making, promotes patient safety, and ensures that critical information about patient status, goals of care, and disposition is communicated efficiently among healthcare providers. As a closing um, reflection, this interview highlighted how intentional, empathetic, and evidence based communication directly impacts patient outcomes and family experiences. It reinforced my understanding of professional communication as a core nursing competency and emphasized the nurse's role as an advocate, educator, and change agent within the healthcare system. Thank you so much for your time and enjoy the rest of your week.